Truck drivers sit a lot. Prolonged periods of sitting, followed by brief periods of time doing lifting, carrying, reaching, and throwing, is a recipe for lower back pain. Disc bulges are a preventable injury. The disc is the shock absorber that sits between our vertebrae. They are made up of two parts, a fibrous outer part called the annulus and a jelly middle part called the nucleus. Sitting and bending pushes the jelly backwards, whereas standing and leaning backwards pushes the jelly forwards. Workers typically complain of pain across the lower back and into the hips. Pain can be achy and may be sharp with associated movement. Pain can radiate down into the buttocks and may refer down into one or both legs. They are typically worse with sitting, lifting, bending, and twisting. They'll often describe stiffness, especially in the morning. The early stages of a disc bulge is often associated with what is called obstruction to curve reversal. This is the stiffness that you get when you stand up after periods of sitting or bending. You should seek medical assistance if you experience what we call red flags. These include severe pain, bilateral nerve symptoms, loss of motor function, saddle numbness, and bladder or bowel dysfunction. When sitting, if the lower back is rounded or the knees are higher than the hips, the load is more on the disc, increasing pressure and the posterior movement of the nucleus. Setting the chair back and the front of the seat base down allows an optimal seat angle of 110 degrees. This places a backward curve in the lower back or lumbar lordosis, reducing the disc pressure. Building up the back of the chair with a pillow or wedge may make this easier if the chair is not fully adjustable. The weakest part of the disc is at the back corners. Sitting crooked in the chair for long periods of time can weaken these parts of the disc. Bending and twisting to place chains or remove chains, and over twisting when throwing wrappers also places the back in vulnerable positions. Try to sit symmetrical in the chair. When lifting and carrying, keep the body straight. Try to maintain a slight backward curve in the lower back. Carrying and lifting weights away from the body or overreaching to generate force causes an increase in load on the lower back. Try to keep the weight as close as possible to the body when lifting and carrying. Where possible, use the legs and body weight to generate force, not overreaching. Not using the abdominal muscles when generating force places more load on the lower back. A 30% contraction of the abdominal muscles is all you need to help spread this load. Balance the disc pressure increase from sitting with extension exercises. These can be done in standing every time the worker gets out of the truck. Repeat exercise 10 times. Slouch over correct exercises in sitting will help to maintain disc nutrition and reduce pressure. Do 5 times every 20 minutes when driving. Prevent back injuries with a home exercise program including strengthening of the abdominal and gluteal muscles, stretching, and mobilization of the lumbar spine. See the back strengthening resource. If extensions make you worse, refer to the lower back resource for alternative stretches or seek help from a healthcare professional. Tape can be a useful tool to help give feedback to a neutral lordotic spine position. See the taping resource. General guidelines for lifting. Analyze the lift. What are the hazards? Use a wide base of support on a stable and level surface. Check for water, mud, ice, and other debris. If necessary, wiggle your feet to get a firm base of support. Contract your abdominal muscles 30% and breathe. Keep the weight close to your body. Keep your chin tucked and the shoulders pulled back and down. Bend from your knees and hips, keeping your feet flat on the ground. Try to maintain a neutral, slightly extended lower back position, and then lift with your legs. Do not twist while lifting. Repeat extension exercises in standing or lying before and after you bend. Exercises should be done in a repetition of 10 held for 2 seconds as opposed to a sustained hold.